Forum policy brief, where we are launching our paper titled Africa Beyond COVID-19. My name is Christine Mundwa, and I am thrilled and honored to be your host today. Welcome to everybody. I want to take a few moments just to extend a special greeting to everybody that's joined us today, wherever in the world that you are joining us from. You're in for a real treat. Now, beyond the human tragedy and the loss of life that we have experienced, that has been brought on by the coronavirus pandemic, there have been a few things that have been exposed for us as a continent. For one, we've seen that our pandemic preparedness is not quite where it needs to be, that there are shortfalls and gaps when it comes to that. The pandemic has also exacerbated existing inequalities in our society, and it's also revealed the fragility of our systems. One thing we've noticed there is that we've got weak productive capacities in our economies on the African continent. So a good saying goes, never let a crisis go to waste. And it is really within that spirit that this policy brief by the Future Africa Forum proposes a number of initiatives. This is for policymakers on the African continent that essentially do two things. One is to help reduce the impact of this pandemic, the COVID-19 pandemic, and the pandemics to come, to reduce their impacts on the people of Africa, but also to use this pandemic, COVID-19, this crisis, as a springboard to secure the future of the African continent. So we're going to be covering 5 core areas, and I just want to run through them for you. I'll take a minute to do that. That is, of course, healthcare and the preparedness response, social welfare and safety nets, education and training, industry and employment, as well as trade and infrastructure. You're going to be hearing from the people that have authored the research, that have done all the reading that there is to be done, that have looked at the trends, the facts, and the figures that are out there. And they're going to be giving us a summary in this time that we're together as to what they have found. And they're going to be making some recommendations and sharing with us their suggestions. But before we go there, I would like to introduce to us at this time one of our guest speakers, if you will allow me to perhaps call them that, and that is our esteemed, one of our best health advocates from the continent, one of our best exports in that particular sector, and that is the one and only Dr. Githinji Gitai. Welcome to Dr. Gitai. It is such a pleasure to have you here. Dr. Gitai is the Global Chief Executive Officer for AMREF, and he's going to be telling us a little bit more about the efforts that he has been coordinating at that level. In fact, that brings me, Dr. Gitai, to my first question, which is, just start by telling us what your experience has been as you've been coordinating COVID-19 across 35 countries in Africa as the AMREF Global Chief Executive Officer.
So my learning across this response, working with multiple countries in Africa and working closely also with the Africa Centers for Disease Control and Prevention, is that number one, institutions are important. The Africa CDC was created post the Ebola response in West Africa with support of Africa Union and with the support of other partners. And the Africa CDC has been a critical pillar in this response, not only bringing together policy, guidelines, and strategy and the response, and also knowledge sharing across the continent, but also being able to mobilize different partners, multilateral partners, bilateral partners, private sector, foundations, in ensuring that Africa has resources needed for preventing transmission, preventing death, and also preventing social harm. And we have seen Africa CDC and also countries and Africa Union come together to mobilize platforms like AVAT for vaccines, mobilize PPEs from different partners of the continent. But the key learning for me has been that Africa cannot continue to rely on its partners' goodwill. It has to build its own capacity for human resources, capacity for commodity security, and capacity also for manufacturing locally, which also requires us to think about driving further the ratification of the Africa Free Continental Trade Area, as well as a common approach to medicines regulatory, which is the African Medicines Agency. These are critical for building Africa's capacity for this pandemic and the future pandemic as well.
So, Dr. Gidai, while we're there, can you tell us about some of the roles that can be played by the social sector, that is, of course, through international NGOs like the one that you represent, AMREF? What roles can be played which then go on to complement governmental efforts?
The social sector, which we otherwise also call the third sector, because you have the public sector, which is led by government, then you have the private sector, which is led by private interest for profit, and then you have the social sector. And the social sector sits as a third sector in the middle of that. And in this COVID response, we've seen the role of the social sector, most importantly, has been to mobilize communities. Governments and private sector are not good at mobilizing communities because the private sector is looking at return on investment, shareholder investment. The government, again, on the other side, is looking at regulations and policy, and it doesn't have easy ways through its public resources to mobilize, unless through, of course, the existing leadership structures. But sometimes you need community mobilization, mobilization of community health workers, and also the second role has been to broker trust. Brokering trust is important because the social sector is part of civil society and it is highly respected. And this includes young people, like the experts who've done this policy brief, includes those who are most vulnerable, women and girls, includes bringing voices that would ordinarily not be in a private sector boardroom or would not be in a government ministerial meeting. So that has been the role of the social sector, and it continues to be extremely key in overcoming community hesitancy, skepticism on vaccination, and also acceptance of the public health measures that are put together by government. So this is what I see as the critical role for social sector like ourselves, like AMREF Health Africa and others, and including working with community-based organizations, because if something hasn't happened in a community, in a household, it's not happened.
And the last one for you before I let you off the hook, Dr. Gidai, you've just been appointed to the new Commission on African COVID-19 response. And I wondered if you saw this new role as one that will enable you to represent the voices of young experts like the ones that have co-authored this policy brief, as well as other social sector members playing important roles in tackling COVID-19, this particular pandemic?
So my appointment, which I feel very privileged and honored to have been appointed by President, His Excellency Cyril Ramaphosa, to the Africa Commission on COVID-19, is actually testimony to the fact that Africa has grown to a level where it's relying on its own experts a lot. And this commission is going to stand up to this test to say that we are going to serve the continent as the continent requires. But also, most importantly, for someone like myself coming from the social sector, AMREF Health Africa as an international NGO headquartered, based and led from Africa, is to say that our role as an organization, my role as an individual, as a commissioner, is to ensure that the voices of stakeholders, young people, women and girls, and others who may not be on the table are represented. And therefore, we need to take advantage of this presence. And for us, and for me as a commissioner, I am hoping to reach out to people like yourselves, young people and others, to hear more about what would you like to see the commission reflect on. Specifically, I have been requested to chair the working group on Africa's recovery for social, health, and economic recovery. And this cannot be done without half the population of the continent. The youth in this continent account for half the population, with more than 50% being under 19 years. Now, we cannot ignore 75% of the population that's under 35 years in Africa in the work of this commission. So I would truly hope that I'll hear from you, that I'm going to reach out to you, so that we hear your views that we can then input into the Commission as it does the advisory that His Excellency President Cyril Ramaphosa will be providing to the African Union through the Bureau of Heads of States that also, in a way, impacts the strategy of the African Union and will impact the strategy of the African Union in continuous response for this pandemic and also in preparing Africa for any future pandemic. So I look forward to working with all of you. That's really what I look forward to. Thank you.
Thank you so much, Dr. Githinji Gitai, for your thoughts. And as I said, you really are one of our best health advocates on the continent. Thank you so much for weighing in on this for us. At this juncture, ladies and gentlemen, I'd like to introduce to you our next guest speaker for the day. I am pleased and very much honored to be introducing to you Her Excellency Toyin Saraki. She is the founder and the president of Wellbeing Foundation Africa, and she is currently in the United Kingdom. Thank you so much, Her Excellency, for coming along and being on the platform for us. Her Excellency, if I can begin by asking you about how your home country, Nigeria, has responded to the coronavirus pandemic. From where you sit, what more can be done in Africa's biggest economy?
That's a great question, Christine. Thank you. It's great to be joining the Future Africa Forum for this pertinent conversation. I'd like to begin by congratulating the young experts who've authored this timely policy brief. Daring to dream, challenge, and appear on the scene, armed with solutions, is a bold and necessary move, all the more so when you're a young citizen within society. I commend you, celebrate you, and support your efforts. Nigeria's social sector response is most visibly and swiftly led by the private sector and philanthropies, which then cascade into the wider social sector, which is made up of you and I on the average day, because we are the makings of our society. The government, encouraged by strategic philanthropic support, was also swift to build capacity through the establishment of subnational emergency organizing committees, all linked into the NCDC. By March of 2020, the Private Sector Coalition Against COVID, CACOVID, was launched, warehoused at our National Central Bank, as an initiative which sought to tackle the pandemic by way of gathering solutionary resources across industries and sectors. At my own Wellbeing Foundation Africa, where our primary focus is to provide a continuum of care and counsel for childbearing women, their newborns, and their families, while supporting the healthcare workers that are fighting to deliver safer births, we immediately drew upon both our decades of experience to adapt our frontline programs and the standard bearers that are the WHO, as well as drawing on our established partnerships to create and conceptualize greater digital capacity to reach the shifting frontiers. From launching a free and accessible self-symptom checker to incentivizing autonomous surveillance with Nigeria's first electronic grocery voucher within our COVID self-check, and ramping up our WASH advocacy to better guide infection prevention and control, we were fortunate to be able to harness that resilience to respond to the pandemic crisis while calling for continued and uninterrupted access to primary health services, because childbirth waits for no one, not even for COVID. Our midwives rose to the challenge, protected by masks, of standing with women at their most vulnerable time of need, bringing new life into the world, and while doing so, they also reinforced the role of the female gender in health workforce leadership. When I think more specifically about the COVID-19 pandemic, I'm both reminded and encouraged by the all-hands-on-deck guidance that was both imparted and adhered to by every global citizen, so that the journey towards building back better that we find ourselves navigating today could start with some confidence. Whether it was ensuring that essential public services were in a position to continue in adherence with the COVID guidelines, or whether our pregnant women were still able to access equitable and affordable healthcare, we were able to actualize the concept of our continuum at large. We have witnessed and experienced national curfews put in place to minimize the prevalence of social gatherings and to deter an attitude of non-compliance, as well as government bodies academic institutions and healthcare facilitators adapting to change as rapidly as our citizens require. I believe that what is next on the agenda is that same shared responsibility that we all adopted in terms of compliance to extend itself to donorship, recalibration of infrastructures, and new ways of working, living, and accessing equity. From a health and care perspective, we have now proven amongst our nation that tracking, tracing, testing, and having a completely individual, independent ownership of care and well-being is possible when we adhere as individuals and create the guidance as advocates or lawmakers. Going forward, I'd like to see a truly localized, culturally sensitive approach to health, care, and well-being being taken by those who are saddled with the responsibility of facilitating it.
Her Excellency, the Wellbeing Africa Foundation works very closely with women and children, and I just wanted to get a sense of the impact that you have witnessed on this particular demographic in Nigeria. We know that women in particular have been disproportionately affected by the COVID-19 pandemic. Tell us about what you've witnessed in your home country, Nigeria.
Christine, the Wellbeing Foundation Africa's programs, mission, impact, and daily delivery reach the last mile of about 8,000 women, their newborns, their children, their families, and their households, health and education facilities each month. For Nigeria as a nation, like in every other nation, the pandemic created heightened disparities and therefore riskier vulnerabilities. But, and I say this cautiously, responding to the pandemic afforded every sector another chance at intentional systems delivery design, strengthening essential frameworks that had previously clearly not been strong enough. It's ironic because a lot of thought and strategy goes into the content of our programs in terms of the individual delivery, but the ways in which we remain committed and actualize the concept of delivery itself is almost innately secondary. Because the Wellbeing Foundation Africa has always placed doctors, midwifery and nursing professionals at the heart of our frontline health workforce, the pandemic did not infringe on our ability or desire to do. Thus, the journey of each midwife regarding their ability to expand on skills and services to support mothers of the most vulnerable to achieve their goal of a safer and respected birth experience, which, when well guided and supported, equally delivers the breastfeeding goals of early and exclusive lactation, powering neonatal nutrition. We know that breastfeeding is and will always remain an essential component of health and well-being, not just for the infant and the mother, but for society and the planet. So in addition to the minimum recommendations of 8 antenatal presentations that women have been encouraged to commit to throughout COVID-19, our Wellbeing Foundation Africa's Continuum of Care makes the key reiterations of breastfeeding practice possible and prioritized through our MamaCare WhatsApp communities. Women are building and becoming privy to a sense of community which is bustling and offers a new type of contact outside that which we've been more traditionally used to in seasons of celebration past. They're not only able to glean from one another, they're also afforded a true continuum of care regarding all aspects of their pregnancy and postnatal period 24/7. We cover nutrition, signs of lactation, and in turn engorgement, which is often discovered and discussed in between clinical presentations. For our adolescent girls who had not been able to assemble for our traditionally disseminated personal, social, and health education programs, we saw real maturity in their social standing and engagements. They have proven that the increased uptake in the WASH curriculum in past seasons had not been in vain, and we only have to look to social media and other platforms to assess that very demographic's contributions to accurate dissemination, particularly at the height of the pandemic. On the other hand, we also knew nationally that the 19 to 25-year-old demographic in particular was a high concern in the context of SGBV. It took a whole community approach and a consistent global commitment to ensure that women were signposted and in essence saved during the height of the pandemic and lockdowns because they weren't able to access their usual places of solace and safety, and many were trapped with their abusers.
And perhaps a twofold question to end off our conversation, Her Excellency. What really would be your biggest concern stemming from the pandemic? And perhaps what are you most optimistic about?
My biggest concerns stemming from the pandemic and what I'm most optimistic about are that we mustn't normalize the risk that we run in becoming accustomed to what I call a blended funds allocation and distribution approach, a persisting inequity regarding women's leadership, and that all decision makers in every sector must now take the time to intentionally and deliberately include youth expertise. The idea that increased inbound donations collected for the delivery of constructs like WASH and routine vaccinations and immunizations will be grouped together with relief and programs that our country of Nigeria and others are creating as part of the global bid to build back better is a concern to me. It's important that calls for funding remain well itemized and intentionally separate, even though we do cross-cut, so that we can truly identify and account for each society's area of improvement and area for further development. When I decided to engender the Wellbeing for Women Africa's Youth Partners Initiative in 2014, I had hoped to find and give African youth voices the opportunity to deepen expertise on development issues. At its culmination in 2020, as the over 200 youth experts from 36 countries braced themselves to continue working and learning independently through the Covid-19 pandemic, they also launched the important Wawimbi report, making the point that in order to facilitate true change when it comes to women in leadership positions, we need first to analyze it on a local level. While many might suggest that equity in women's leadership is still a generation away, I choose to be encouraged that that generation must start from someone, and I believe that the young ones are ready, willing, and quite possibly with a lot of merit, ready to lead. Lastly, and closer to home, in Africa and to the health frontline, I remain hopeful that the resilience that our frontline teams chose to recalibrate within them will not be taken for granted nationwide. It took and continues to take courage to stand in the face of any risk, and a risk that is particularly heightened within our ethnic classification is one that should be correctly protected and well managed. PPE, priority immunizations, adequate training and upskilling should be made a priority to each member of our healthcare system's multidisciplinary teams. I believe it's everyone's responsibility to protect our frontline and public sector contributors, just as they continue to protect each of us last year, this year, today, and tomorrow. I'd like to thank you, Christine, for the opportunity, and I'd like to thank the Future Africa Forum and all its contributors for the work that you're doing, for this policy brief, and for lighting the way forward. Thank you.
Thank you so much for that. That is Her Excellency Toyin Saraki. Much appreciated for the time that you've taken out to share your thoughts and insights with us. Now, I'm pleased to introduce to you the founder of the Future Africa Forum, Gerald Chirinda, who is going to be coming up shortly. Gerald, it is absolutely fantastic. I might just start off by saying congratulations on really having put all of this together and brought all these minds together. There's certainly lots to be taken away from today. Believe you me, you will be hearing from some of the people that Gerald's managed to mobilize in the coming minutes. But Gerald, perhaps just start by introducing to us the team and the brains behind the Future Africa Forum. Tell us more about the brief and the team that's put it all together.
Thank you, Christine, and thank you for a very wonderful summary and overview of why we're gathered here today. Now, allow me to begin by expressing, my profound gratitude to everyone that has contributed to the journey of developing the brief. Now, in as much as this brief was drafted by young experts and professionals, we are fortunate to also have senior leaders, that believe in us and in the work that we are doing. So I would like to take this moment to specifically thank such leaders. who include, in absentia, Her Excellency, the former President of Liberia, Madam Ellen Johnson Sirleaf, who took time out of her incredibly busy schedule to write the foreword for this brief. I would also like to thank our two special guest speakers today, and that includes Her Excellency Toyin Saraki, the founder and president of Wellbeing Africa Foundation, as well as Dr. Githinji Gitai, the Global Chief Executive Officer of AMREF Health Africa, for also making, time to be at this launch. And Dr. Githinji, thank you for the special message in the brief, that will be available after this event. Now, to answer your question, Christine, the Future Africa Forum is an African-focused organization that was established in 2018 to serve as a platform for dialogue and thought leadership on the issues and trends concerning the future of the continent. Now, the two forums, sort of like core areas include thought leadership as well as championship and advocacy. Now, through these programs, we focus on shaping policy and programs through publicizing innovative and effective proposals and lobbying government officials and regional bodies for their implementation. Now, the forum has also highlighted the role of young African thought leaders and professionals as agents of change, and has convened a range of experts from different sectors to curate content and engage in dialogue on the future of the continent. Now, this particular brief has 17 such young African experts from various fields, who contributed towards it, and you'll get to hear from some of them today, and you can also get to learn more about the others from our website. We're incredibly fortunate to be surrounded by such great and diverse minds who get to collectively build the future of Africa with us. And I'm personally appreciative of the amount of work and effort that this group, as well as our own Future Africa Forum team, have put into this policy brief as well as this launch event.
Now, tell us more about the purpose of this brief and its distinctiveness. What will make this particular policy brief stand out, Gerald?
Absolutely great question, Christine. And, this brief is really meant to be practical and implementable by governments. You'll realize that, when the COVID-19 pandemic hit, most, if not all, governments took reactive measures to try and curtail the spread of the virus. But being reactive is not a long-term solution. We need to be more proactive so that when faced with a situation such as this, we are better prepared. Secondly, the brief is anchored on collaboration and inclusion, with the specific focus on how governments can leverage private and social sector sort of capabilities in combating this pandemic. Now, first of all, you need a strong private and social sector, that can aid in responding to such challenges. Take a look at how most African countries supply chains, for example, were affected when the pandemic hit, because for the most part, African countries are not producing what they should be on the continent, and we are relying largely on importing. So this requires a remedial course of action to make sure that our private and social sectors are, somewhat fit for purpose and are provided with an environment that enables them to increase their capacity to manage growth, as well as to tackle adverse sort of events. This policy brief has focused on 5 critical areas that we, feel governments need to focus on for future purposes. These obviously are not exhaustive, but, what we focused on really were areas such as healthcare preparedness and response, education and training, social welfare and safety nets, industry and employment, as well as trade and infrastructure. Now, within the brief, and without giving much away, of course, we show how these 5 sort of areas interact with each other and how interconnected they are. So we highlight new approaches, across each area, and how they can reinforce each other in coherent national as well as, regional strategies.
Just one more for you, Gerald. How do you see these recommendations that are in this policy brief, how do you see those being used or implemented by your target audience?
So Christine, these recommendations can be used by governments, private sector, as well as social sector actors as a roadmap, template, or even a way of thinking of how they can be engagement amongst themselves. And we acknowledge that country context differs, and hence we believe that this brief can be customized or tailored for a specific country, depending on their conditions or their needs. Secondly, and in line with my first point, we as Future Africa Forum are not just saying we have prepared this policy brief, here you go, figure it out. But we believe that there is an opportunity to engage, an opportunity to support governments, private as well as social sector players, to build on these concepts, into already existing national or regional programs. It's not like these governments have been sitting there doing nothing, but, we believe that, hey, listen, how best can we add value to what it is that you're already doing? And some of them already have, national task forces in place. And we are just presenting a different sort of perspective that we believe could add value to the work that they're doing. And, in closing, Christine, my main rallying call is really for governments to build effective coalitions beyond government programs, beyond their own programs, and to do so in a collaborative manner with private as well as social, sector actors. I think when that is done, we will definitely see sort of great results taking place. And I think, part of which really is look at the environment that you have created for sort of private sector as well as social sectors within your country. Is it fit for purpose? Is it fit to respond to such pandemics and to such crisis should a challenge like this ever arise again? And if not, then I think it's very important that you begin to have these discussions now with these players and see how best you can create, as a government, a more conducive sort of environment. Thank you.
All right. On that note, thank you very much, Gerald, for that. That was the founder of the Future Africa Forum. Thank you, Gerald. Now, I want to introduce to you somebody who played a very pivotal role in overseeing this policy brief that we're going to be unpacking shortly. His name is Muna Ngenda. He is a political economy of development expert. And as I said, he was very, very instrumental in providing oversight for this policy brief. Muna, it's great to be talking to you. Perhaps start off by telling us what are some of these central ideas that you would want readers to take away from this policy brief, from this document?
Thanks, Christine. This brief is meant to drive conversations around adaptation and repositioning, how communities from neighborhoods to nations can see crises like these, health or otherwise, as potential windows for radical, positive change. This is a time, yes, to rise to new challenges, but also to make sure we don't miss new opportunities. The pandemic is forcing everyone to rethink our economic activities and our social relations. So now, more than ever, we need policymakers, business, and civic leaders to think ahead and push the continent ahead by strengthening our local networks and renegotiating our global partnerships on better terms.
And Muna, what would you say are some of the guiding principles that bring the sections of this document together?
The recommendations are written around three principles: resilience, equity, and productivity. What that means is building systems and relationships that are less vulnerable to crisis, fairer to everyone involved, and better suited to local needs. We have to pay serious attention to all three and keep in mind that each of them depends on the others. The pandemic has already demonstrated these interrelations in that a public health crisis can have serious economic implications that then require political and social initiatives to address. So our response and recovery has to combine restitching the very fabric of society with improving our ways of doing business and changing our relationships to one another, the environment, to the state, and to international partners. That's really the core thinking and the background conversation that went into producing the brief. You'll hear next from the area leads what these principles mean to each of them and what they mean for all of us in doing things differently going forward.
Thank you so much, Muna. That was Muna Ngeda, who, of course, played the pivotal role of overseeing the brief that we will now be unpacking. So let's get straight into it. And of course, I did introduce to you the 5 areas that we'll be covering. We're going to be starting off with the area of healthcare preparedness and response. And for that, I'd like to introduce our first speaker of the day, and that would be Noella Bigirimana. And Noella, it's great to have you there. I'm going to start by asking you, what type of healthcare system is fit for purpose on the African continent? And perhaps are there any examples that you can give of one that is the best, perhaps what you maybe consider to be one that is even just almost there?
For that important question. It is quite timely because as we speak today, there is an increase in the burden of COVID-19 on the African continent. And so it's been estimated that over the past week, there's been 30% more cases of COVID-19 and up to 20% more deaths recorded due to COVID-19 across African countries. So this is the right time, and it's so very important to be looking at ways to leverage the government, the private sector, the social sector capabilities in the ongoing response, but also in preparing for the next public health threat. So we must build the resilience of our healthcare systems. It involves, as we mentioned in the policy brief, it involves building capacities and building our surveillance systems, building our testing systems. It involves more investment in healthcare workers, in the retention and in the recruitment and the training, because they are the cornerstone of our healthcare systems. But it is also important to look at the healthcare facilities and build surge capacity, increased capacity in critical care. And not only critical care, but ensuring that we can maintain essential services, even in the time of crisis, like COVID. And so we've seen how important it is with all of these pillars to have a multi-sectoral resource mobilization and coordination in place. I'm part of the COVID-19 Joint Task Force in Rwanda. And over the past year and a half, that we've had the preparedness and response in the country, we've seen how important these pillars are in the response. It's important to build on partnerships in private sector and social sector. And these have been instrumental in our response and in building back better.
Noella, there is a lot of talk in recent days about vaccine equity, about availability. My question to you here is, what needs to be done to make sure that we as Africa don't find ourselves in the same situation like we are in today in the future?
So vaccine equity and vaccine availability and access, as we were mentioning, has become a critical aspect to consider in the current pandemic response, but even in the long-term preparedness to any other threats. So we've known these challenges, especially in Africa. We know that only 1% of the vaccines that are used on the continent are manufactured within African countries. And specifically for COVID-19 vaccine coverage, it's been extremely low in Africa. And an estimated less than 2% of the African population in total has received 2 doses. So it's less than 2%, and that's compared to 60 up to 70% coverage in other areas of the world. So the real fundamental question is, how do we get more doses delivered to African countries, because the need is there, the population is there that needs this coverage, because vaccines are here, we know they work. An important aspect to consider in the long term is building local manufacturing. And there's been some exciting announcement lately with 3 hubs, and that's 3 countries, Rwanda, Senegal, and South Africa, that have been selected to be the focus of building capabilities for local manufacturing and continental manufacturing for COVID-19 vaccines. And hopefully this is the first of many steps, because preparedness and these investments into the know-how, the technology transfer, the regulatory strengthening, the finance part, they have to be a constant, not just in a period of pandemic, although that's been a catalyst, but really in the long term, so that we don't find the same challenges for the next public health threat. So this question is absolutely important and should be a focus of the discussion.
Thank you so much, Noella, for that. Our next area of focus is education and training, and for that, we'll be hearing from Priscilla Britour. Priscilla, how practical is learning from home in Africa? We're talking about a place where access to data and electricity is difficult for a lot of people. A lot of people don't have access to data and electricity. So just give us a sense of how practical, or perhaps even impractical, learning from home becomes in the African context.
Thanks for the question, Christine. Learning from home in most African countries is largely impractical, considering the lack of internet and power infrastructure, as you have already mentioned. The requirements for students to learn from home as a result of the shutdown of schools will definitely produce more adverse consequences in African countries. And this is primarily because of huge disparities in context, infrastructural development, and also resource availability between African countries and those of the West. We need to more critically consider these disparities when making policy decisions. Even within African countries, there are significant differences between rural areas and also urban areas. There are also important contextual differences to consider here when making education policy. Some urban areas have relatively better infrastructure. So in such areas, it might be more possible to use blended learning approaches in reference to face-to-face and remote learning, and also alternative teaching and learning platforms such as radio and television in the delivery of education. This strategy, however, is quite impossible to implement in rural areas, which are largely more impoverished, as they will definitely need more extensive and pervasive structural reforms to provide more inclusive and more flexible learning for the learners in rural areas. And all these things are necessary to do in order to promote continuity, equity, and resilience in learning.
Priscilla, we also know that a number of jobs have become redundant in the COVID-19 pandemic during this period. How do we train people for new skills in this environment? What should be the best approach, judging by the research that you've done?
That is a very good question, Christine, and thank you for asking it. In most African countries, the large segments of the youthful population, are vulnerably employed, either in agriculture or the informal economy. There are very few social safety nets, and these the job security of these individuals is in question. So the control measures being implemented against the pandemic and the disruption of global value chains inevitably will disrupt these work opportunities. There is therefore the need for continuous capacity development, competency-based skills training in order to orient the population, or the youth primarily, towards entrepreneurship, and also to ensure that they are more sustainably employed. This will definitely demand the creation of a more conducive environment for businesses and industries to thrive. It is also important in this particular regard to consider the current structure of African economies and the pervasiveness of the informal economy when developing training opportunities for the current African population. It is also very important to engage relevant development partners, including civil society and the private sector, to ensure that training remains relevant and not detached from the skills needs of the economies of African countries.
And that was Priscilla Britour. Thank you so much for that, Priscilla. So from education and training, we now go to industry and employment. And for that, we're going to be hearing from Maodo Jallo. So Maodo, the first question to you really has to be about the jobs that have been lost because of the pandemic. Now, we all know that Africa already had very high unemployment numbers pre the pandemic. Secondly, a lot of companies have gone under, and those tend to be your MSMEs, so your micro, small, medium enterprises. How can we rebuild industry and create employment at the same time, Maldo?
A lot of people have lost their jobs. Employment rates have plummeted, and also we see a lot of companies that have gone under, particularly SMEs, who have really struggled during this pandemic. And what I think will really create a difference and will spur sort of a recovery here, I mean, there are three ways that I think governments can do this. And we talk about this in the report. So one of them is that, you know, we should look at expanding the fiscal space, so going beyond the usual sort of constraints that are put on African governments, and you know, also looking at new ways, innovative ways of financing economic recovery. So everything that should be on the table, essentially, looking at loans, looking at funds that have been created for countries and also for companies to get through this pandemic. They will all be incredibly important, because none of it will be possible without an expanded fiscal space and more money made available to these countries and companies. And with that money, we can then look to rebuild and fund various sort of labor-intensive industries that will then be able to employ people back into the labor force and also spur economic recovery. So that would be number one. Number two is, I think it's time we really start looking at increasing not only productivity, but overall competitiveness of African industries and economies. So looking at how can we cluster different industries in order to create greater efficiency. I think it's time to really consider that. And finally, looking at tech. I think it's something that at the moment, particularly because of COVID, you can no longer ignore as a government, as a company, and even as an individual. And I think that would be the final point for me. So the third point being really sort of embracing and focusing on sort of digital technologies and frontier technologies that will be able to increase, again, productivity, so we can jump ahead and really make some gains and help us recover from this pandemic.
Maldo, are we likely to see less foreign direct investment flow into the continent now after the pandemic compared to previous years? And if so, just give us a sense of how we can leverage, if at all, we can leverage local investment to build back better from the pandemic.
So for me, the key thing here is to focus on local investment at a time when we've seen a huge drop in foreign direct investment coming into the continent, particularly in sectors that have been impacted by COVID, everything from sort of hospitality to some of the other sectors that, you know, again, that have been badly impacted by this. So the key thing here is really to strategically look at how we're investing money. I think a lot of African countries have a lot of capital sitting in their banks and also in other places like pension funds and so on. And we really need to start looking at how we can strategically invest those funds in productive sectors. And by productive sectors, I mean sectors that will spur economic recovery and also employ people. So looking at things like light manufacturing, for example, would really not only create employment, but again, would broaden the tax base and so on. So there are various sort of benefits that would then flow from that, which would then allow for that investment to be recovered. And I think we need to move away from certain sectors that are less productive, i.e., sort of rent-seeking sectors that essentially don't necessarily create the same knock-on or trickle-down benefits, if you will, that some of these other productive sectors do. So really, it's not about digging. It's about just rearranging or reprioritizing some of the investments that we already have, or rethinking how we use the funds that are already sitting in as I said, pension funds and other places and banks, and using that as capital to really spur an economic recovery in these areas, particularly in a time when FDI has plummeted and doesn't look like it's going to recover to pre-pandemic levels for a while.
Thank you, Maldo. That was Maldo Jago. Now, we're now going to pivot to the area of social welfare and safety nets, and for that, we'll be hearing from Malene Rousseau. Malene, from a social perspective, just tell us about the one big idea that has emerged from the work that you have done.
Thank you very much for that question, Christine. Now, we know that the COVID-19 pandemic not only exposed but exacerbated the social challenges that many African countries were grappling with long before this pandemic. Challenges such as poverty, malnutrition, food and income insecurity, lack of access to healthcare and water, amongst other. We also know that this pandemic has affected all people, some to a less extent than others. But the largest group impacted and exposed and left with absolutely no support and protection whatsoever were people working in the informal economies across the continent. Now, not to detract from our other recommendations, but one of the big ideas that emerged from the social welfare and safety nets group was that national governments across the continent must engage with community organizations as well as small businesses in joint efforts to protect the livelihoods of citizens, but place a particular focus and emphasis on people making a living in the informal sector. Now, when we talk about the informal sector, I think the scale at which we are talking at is often underestimated. The informal economy accounts for 85.8% of employment in Africa, which makes up a quarter to 2/3 of national outputs across different countries. That is massive. So one of the policy objectives of the social welfare and safety net group is to establish informal business support networks. Now, of course, the informal support business networks will have a range of objectives, but I will endeavor to discuss a few critical areas. The first objective of these informal business support networks would be to provide market information and financial buffers against work disruptions without immediately imposing the cost and risk that informal entrepreneurs often associate with formalization. These informal business support networks can take the form of business associations or workers' associations, and they must provide insurance schemes as well as saving schemes for these informal businesses. A very critical aspect that these networks will also be tasked with is to collect data and to analyze data of the informal enterprises. And the reason why most of these informal businesses is not adequately protected or supported is because of the fact that there is no data readily available to inform any policy or strategy or plan that may or may not affect them. So that is quite revolutionary. And then lastly, to provide actionable business leads and resources, leveraging from existing networks, as well as financial inclusion initiatives in the process. The rest you will have to go and read within the policy brief.
Meline, that's very fascinating. But tell us from a country or perhaps even a continental level, what has been done well? And perhaps while you're there, what could be done better? Where do the gaps still exist?
Thank you very much for that important question, Christine. The reality is that most, if not all, African countries went into the COVID-19 pandemic unprepared, under-resourced, and undercapacitated. In 2019 already, the Global Health Security Index indicated that in the event of a new health threat to the world, that African countries would be least capable of dealing with this new health threat. And in 2020, that capability was put to the test. As much as we have success, and I agree, we did, I still believe that our challenges far outweigh the success. I mean, the world commended Africa for its swift and multilateral response to the COVID-19 pandemic, especially in the early stages. And when I talk about early stages now, it's the first and second wave. And the reason why we were successful was because of two reasons. One, we implemented the lockdown measures immediately. When the Western world was still wondering whether or not this evidence-based intervention was going to work, we had hard lockdown in most of the African countries. And that was obviously to curb the spread of the virus. We closed the borders, we cancelled flights. However, those large-scale restrictive measures had severe consequences for the economy. And now we are dealing with those repercussions. The second reason why I think Africa was very, very progressive in terms of its response in the initial stages was because of the collaboration. The health ministers came together, they strategized, they came up with a plan. The plan was to, number one, prevent transmission. Secondly, to mitigate community spread. Everyone went back to their countries, they implemented the plan. It's great leadership because they showed leadership. That is why we were so responsive. I think the third aspect that we can say thank you for, but not necessarily applaud, because if we had a strong economy, the scale of the social and economic relief measures would not have been at the levels that it was. But there was stimulus packages. There was unemployment grants, like in South Africa. We had food relief measures in place. And that is commendable. But the reality is we are still struggling. If we look at the third wave and the havoc that it's causing in about 21 countries on this continent, Ethiopia, DRC, Uganda, South Africa, Kenya, for example. I mean, there's more. They are buckling. Their health systems are buckling under the strain of this new variant. And the reasons why they can't cope with it is because of the fact that the procurement of vaccines are taking forever. The vaccination rollout is happening at a snail pace. Testing is not happening rapidly. And if you don't test, you can't track and you can't respond. You need to be able to test at a speed that is necessary in order to track and respond effectively. So, in as much as there has been progress, there has been a lot of regress as well. And the aftermath of this COVID-19 pandemic is going to be absolutely devastating. It's going to require all hands on deck. It's going to require innovation on a level that we've never seen before in our recovery efforts. Otherwise, the future for Africa is very uncertain.
Okay, and we'll leave it there for the minute. Thank you so much, Meline Rousseau. We're now going to pivot to the area of trade and infrastructure. And for that, we'll be hearing from Daniel Owusu Ashimpong. Daniel, I want to begin by asking you, we have seen that trade has been particularly impacted during the pandemic. We've seen a number of border closures between countries, between a number of countries on the continent. I want to dwell specifically on cross-border traders because they are the majority of traders on the continent. Talk to us about how they are coping.
Thank you for your question, Christine, and it really is an important one. Cross-border traders have really faced the negative effects of this virus and had to live them out on the ground due to the policies that were put in place to curtail the worst of this virus on the continent. To my understanding, there's around 107 land borders across the African continent, and different African countries, as I'm sure many of you are well aware, implemented different responses to the pandemic. So from a land perspective, land cross-border trade, but also thinking about air and maritime, cross-border traders have really had to either adjust or completely halt their activities. Also within recent times, intra-African trade stats have signaled to the impact of this virus on cross-border traders. So intra-Africa trade has been down by 17%. In comparison, so in April 2020 when compared with the previous year. And also Africa's trade with the rest of the world during that same time period was down by around 35%, and cross-border traders would have definitely been negatively affected. So they have been really affected in this time period. But looking forward, as countries open up, as there are more opportunities to trade, as initiatives like the African Continental Free Trade Agreement continue to take steps towards being fully implemented across the continent, there will be many more opportunities for cross-border traders to engage in their activity and hopefully be able to do that in a more efficient and productive way moving forward.
So Daniel, have we seen cross-border traders get any private or social support? If so, tell us how that's worked and perhaps where are the gaps? Where do the gaps still exist?
Thanks, Christine. This is also a really important question. As I'm sure many of you are well aware, African countries just currently don't have the monetary policy space that other countries have in terms of being able to draw upon resources from the private community to finance the types of bailout packages or the types of pandemic response packages that you've seen in many countries. So to be honest, I've struggled to come across examples where cross-border traders have been directly supported throughout this pandemic from governmental responses. But conversations within the policy space have suggested that African countries can look to solutions such as reviewing programming on social support and seeing whether there's opportunities for domestic or foreign partners who have programs within particular countries for them to implement their programs in a way in which cross-border traders could be supported, seeing as they've been so affected by this space. But the other thing that I want to note in response to this question is moving forward, the best thing that African countries can do from my perspective is to really focus on ways in which we can improve, enhance, incentivize, catalyze trade and increase the opportunities for there to be more trade on the continent. And the African Continental Free Trade Agreement has taken a really big step towards making that easier and seeking to increase inter-Africa trade by around 50% by the year 2035. So if these initiatives are able to be implemented on the ground, that would give many more opportunities for cross-border traders to be supported and to have more opportunities to engage in their livelihoods on the African continent.
All right, thank you so much, Daniel Owusu Ashiompong, and that is where we will leave it for the moment. Some of the keywords that I heard coming from you, Daniel, at least, and they don't only apply to cross-border traders, but I think really to all that we're doing on the continent, opportunities and big steps that have been taken. So that brings us to the end of this particular event, but of course, there is a whole paper that is out there to be read that's been put together, of course, by the Future Africa Forum with the input of these authors. You've heard from some of them today, and others you've not necessarily seen and heard from. But I want to take the moment to just thank you all for having spent this time with us, and to remind you that if you go to the Future Africa Forum website, if you go to our social media platforms, you will be able to access the full paper, because what you heard today was really just a teaser. It is a short summary, the highlights of what is covered in that extensive research. Do yourself a favor and acquaint yourself with that paper. And of course, let's make use of those social media platforms to stay engaged in the conversations. We are certainly interested in harvesting your thoughts, your views, and your perspectives. I, on behalf of the Future Africa Forum, want to again thank you all for having spent this time with us. A massive thank you to the contributing authors and those who have come up on the platform here today. It's taken a whole big team in different corners of the world, but we've put it together, and thank you so much. Of course, to the founding team at the Future Africa Forum, a massive congratulations on this excellent paper. I'm certainly looking forward to sinking my teeth into it. So that does it for the moment, and I sure hope to be seeing you soon. From myself, Christine Mundwa, and the team, it's bye-bye for now.